How's it going, guys? We have a past level question for dermatology, step 1, family medicine, TCK, 16-year-old boy. He has a 1-week history of irritating itchy rash in his forehead. 2 weeks ago, he commenced treatment for acne. We have an image here. Question wants to know which following most likely explanation for the patient's findings. Let's just hop through the answer choices. Just say benzoyl peroxide, wrong fucking answer. This doesn't in particular cause any specific side effect. Okay, I mean, obviously it's topical, it can irritate the skin. USMLE does want you to know that this simply functions to kill Propionibacterium acnes. Okay, that's what it does. Just kills bacteria within pores. Not dramatic, not complicated. Wrong fucking answer. Choice B, clindamycin. Wrong fucking answer. Okay, topical clindamycin can be used for acne. In theory, I've never seen USMLE assess it. Okay, so you could be aware for USMLE just in general, unrelated to acne, that the highest yield use case for this is for pulmonary abscess. Okay, they will give you, e.g., 44-year-old alcoholic who has a couple missing teeth, foul-smelling breath, and chest x-ray shows air fluid level. That's your very buzzy pulmonary abscess. And then the answer is just clindamycin, anaerobes above the diaphragm, 50S ribosomal subinhibitor. Wrong fucking answer. Choice C, isotretinoin, wrong fucking answer. So this is oral high concentration vitamin A used for nodulocystic acne or other types of more mild acne that have failed more conservative therapy first. And of course, the highest yield point for this is that it's teratogenic in females. Okay, so they need to be counseled about using barrier contraception, and sometimes they're prescribed OCPs. You have to do a pregnancy test in a female before commencing isotretinoin. In males, it is not teratogenic. Wrong fucking answer. Choice D, retinoic acid, correct answer. Okay, so this is topical vitamin A. So topical retinoic acid, retinal, topical tretinoin, not isotretinoin, topical tretinoin. I almost wrote tretinoin as the correct answer, but I didn't want to be a flagrant asshole the way that Qbank plays gotcha style that way, okay? So you need to know that topical retinoids, they cause peeling of the skin, and they cause photosensitivity that can present as a glowing, itchy, erythematous rash, okay? I guess most rashes are erythematous anyway, so it's a bit of a tautological statement, but the point is it's a glowing red rash that you classically get with topical vitamin A compounds, but desquamation of the skin, okay, increased turnover. They want you to know that vitamin A, it's a transcription factor, so that's what it's doing mechanistically, okay? So it shuts off sebum production in addition. So oral isotretinoin, similarly, this can cause dry skin, it can cause dyslipidemia, it can cause abnormalities with liver function tests. So when we talk about actual side effects for family medicine, for general dermatology, for step 1, even though this theoretically can cause dry skin, they want the topical vitamin A for this glowing red photosensitivity type rash. They have an answer on one of the NVMe exams, which is just they tell you the patient was started on tretinoin, and the answer is just avoidance of excess sun exposure. Okay, so it is worsened with sun exposure. So real quick, and also I should mention that topical vitamin A is not teratogenic. Choice E, tetracycline, wrong fucking answer. Now, some of you, this is an elephant in the room, okay? Some of you are very astute, okay? Just relax. Tetracyclines can cause photosensitivity. However, it tends to be more of a blistering photosensitivity. The other point is that if you're not convinced based on that distinction alone, we don't hop into acne treatment with oral tetracycline, okay? So our typical way of treating acne is a patient will receive a topical vitamin A compound first, e.g. retinoic acid, retinal, topical tretinoin, plus or minus benzoyl peroxide second. Okay, that's what we do initially for vast majority of acne cases. If that doesn't work, we can add topical clindamycin. If that doesn't work, we can add oral tetracycline. If that doesn't work, we can go to oral isotretinoin last resort. And as I said, sometimes patients walk in with nodulocystic severe acne. They can just get isotretinoin straight up. You have to do a pregnancy test. Tetracycline, wrong fucking answer. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.